How can you tell that you might develop jowls? In just a few weeks, you will see amazing results. One of the biggest problems that can add 10 years to your age is having jowls. This is a deformation of the subcutaneous tissue, as a result of which the contour of the oval of the face floats and the face immediately becomes older. But there are a few magical techniques that can solve this problem in just a few weeks. And that's what I'm going to talk about today. First, I want to explain why jowls occur in the first place. There are several factors that contribute to their appearance. The first is the biomechanical factor in our body. All organs and tissues are interconnected. And when deformation appears here, it is associated with stress. Not only in the face, but also in the neck, in the chest, and even in the stomach. The second point is just fluid, swelling. Chronic swelling on the face leads to the fact that the soft tissues of the face begin to deform prematurely. Because the fluid, under the influence of gravity, constantly presses down and stretches the skin and soft tissues, the inner face. The third point is psychosomatics. Our face expresses all possible emotional patterns, and there are many facial muscles on the face. And you can even see in this picture how emotions, tension in the lower third of the face around the lower jaw, and chronic tension in the facial muscles. Ultimately, this will also lead to tissue deformation, swelling, and the appearance of jowls. Now I'm going to show you how to get rid of jowls. But in reality, you can get rid of any problems on your face. You just need to know the techniques and perform them correctly for a few weeks. Why does deformation occur? If you look at this picture, it shows the different layers: skin, subcutaneous tissue, muscles, bones. When tension arises in the muscles and bones, you can see here, highlighted in green, are the lymphatic vessels. Muscle tension creates swelling in the area of the fat tissue, the subcutaneous tissue. Stagnant fluid starts to deform the skin. As a result, jowls appear. Jowls have a distinctive feature because the face is divided into certain fat compartments or packets. Fat compartments between which there is a ligament. And here is the characteristic area where jowls appear. This is a fat pack where the muscles are located. And if there is constant tension in this area and fluid gets stagnant, deformation occurs. And that's how these hanging jowls appear, here in this area. What other muscles affect this? If you look at this picture right here, you can see it clearly. So chronic tension in these muscles, specifically the platysma, is highlighted in green. This is the platysma muscle, the one under the skin. This is the muscle that lowers the corner of the mouth. These two muscles in chronic tension, they cause deformation. Why do they tense up? They express emotions, sadness, sorrow, and gloom. And these go down to the subconscious level, means that these tensions go deep into our body, that is, into the deep inner layers. And even later, when a person relaxes, he still displays the facial expression of a dissatisfied person, and these jowls appear. This is why psychosomatics can already lead to premature aging of the face at the age of 30, 40. And now I'll show you a simple diagnosis to understand if you might develop jowls. It's very simple. When jowls start to appear, there is noticeable tension in the front part of the neck, and right here in the area of the lower jaw. If you throw your head back and feel that you have a tension here, this tension indicates that you already have what looks like overstrained muscles and fascia, which in fact will lead to facial deformation. The second point is that such heaviness can appear on the neck. For those people, especially women who have pronounced heaviness, it indicates that they are overstrained. Often, jowls are connected with heaviness in the neck. The next point is chronic swelling. If you feel that fluid is constantly accumulating here and your face becomes puffy, especially your cheeks, then you understand that it's just a matter of time. It accelerates the aging processes of the tissues many times over. I recommend that you put on a glove or wash your hands. Next, we will be doing an intraoral technique. So our task will be to grab the corner of the mouth where it actually attaches. This is the muscle. Do you see? Our task will be to massage this area. Massage, and you can also vibrate. This helps a lot. So you take your finger, place it in the oral cavity, grab the corner of the mouth, and start making circular movements. At the same time, the other hand can hold the lower jaw. After you've done the circular movements and the vibrations, you finish with kneading massage movements. In order for the tissues to relax, they need to be kneaded so that the stagnant liquid comes out of there. The fluid comes out best when the tissue is already relaxed. Then you make a massaging movement. As you do, that is, you grab the cheek from both sides, up to this area of the corner of the mouth, and begin to rub the jowl area between your fingers. And so you do it for a few minutes on each side. For a few weeks, you will see amazing results. You just need to do these techniques every day. In fact, kneading only the cheeks is not enough. I mentioned there's also the subcutaneous muscle of the neck. You can see on the screen that when it tenses up, it creates these bands, and this also contributes to the line of the jowl. You can work with it easily since it attaches to the rib cage. You can place your fingers right here on the area, under the collarbone, and start making gentle circular movements. Don't pull too hard, just release the tension and make circular movements. You'll feel how this muscle stretches just in this position. Gently pull it a bit. You can also rub it to help those fiber bands relax, and then they will release. So you can do it on one side, then the other. Well, of course, even that might not be enough because, as I said, the jowls can develop starting from the pelvis. Because imagine all the muscles, fascia, organs, they are all untied. So when I pull even a shirt, there's tension. So even if there's a scar deep in the pelvic area, like after a C-section or from... I talk about how to work with all the issues in the body on my channel. So make sure to like and subscribe. See you next time.